This is Dr. Kambiz Tajkarimi. I'm a urologist and a cosmetic surgeon in Northern Virginia. I have the honor of having Dr. Robert Valenzuela, the head of penile prosthesis at Mount Sinai School of Medicine and the hospital in New York City. What an honor, doctor.
Oh, it's my pleasure. Thanks for having me.
This morning, we had 2 cases of penile enlargement with Penuma, Penuma, penuma.com, which is the only FDA-cleared penile implant for male enhancements with penis enlargement. So what did you think about the procedures?
You know, it's great. I've been doing this for the last year and a half, 2 years. I've been doing Penuma, but I always like to travel and visit other surgeons. I'd like to get an idea of what they're doing differently so that I can really enhance my outcomes and so that my patients get better results.
Penuma is a silicone block that is inserted around the penis to enhance the girth and the length of the flaccid penis and the girth of the rigid penis. So it adds about 2 to 3 inches to your flaccid length. Flaccid means, penis without erection, and the girth of the penis. It adds about 1 inch to 1.5 inches to the penis. This is ideal for men who have low confidence in their flaccid length and girth, and also they want to have a more girth. This procedure has gone through an evolution of improvements in the past 2 to 3 years. We now are able to place it in a much less invasive fashion with a very low complication rate and risks of common things that can happen to any type of implant, such as bleeding, infection, or skin problems. Dr. Valenzuela and I, we have been instrumental in improving this device along with other 8 urologists that are across the United States. We all work together to put our minds together to constantly improve this device. And what did you think about the new updated implant?
I think it's awesome. I think it's nice and simple, a lot easier to place, less movement, less economy of motion is so important. Less dissecting seems to make the procedure go a lot quicker, easier, and less traumatic for the patient. The closing is just phenomenal. It just closes off really nicely, and they really have very little dissection in that area, so the post-op looks really nice.
For those who are watching, tell us, Dr. Valenzuela, who is the ideal patient for Penuma?
I think any guy who feels insecure about their appearance, when you look down and your penis is retracting and you feel ashamed or embarrassed to go to the bathroom and to be seen by others, that's one guy that's really, who's really a good candidate. In addition, you take a guy who has a normal erection, completely normal erection, normal sexual function, but it is insecure about the girth of their penis. Yeah, penis could be a normal size, but if they feel like it's very thin, we all talk about girth. Size matters, but girth really matters. And I think those guys that feel insecure about the girth of their penis when it's erect, this is also an ideal patient. So guys with retractile penis, insecurity about your penis, when you're fixated about how you look and when you spend so much time thinking about it, we finally have something that we can offer our patients that we can do something about.
Perfect. In my opinion, we get patients from all over the world, married, single, heterosexual, gay, who want to improve their confidence. This is a very important point, is we want to have patients who are physically and emotionally healthy patients. You want to be able to deal with stress of a change in your body. So you don't want to be just getting an implant as of an impulse behavior. You want to study it well, fully understand the risks and potential complications from this procedure, and also be completely dedicated to following post-op instructions to reduce your risk of having problems.
Yeah, I agree. I think the best customer is the person who is very well informed, very well educated. And I got to tell you, most of my patients that come in, they've been looking at this for 1 year, 2 years. They've done the research. They've seen the evolution. In fact, I encourage them to go out and look for the good, the bad, and the ugly so that they really get a good sense of what they're getting themselves into and feel good about what they're doing.
A common theme that I hear, I do a lot of virtual interviews with patients all over the world, is, doc, I have a perfect sex life, but I've noticed as my wife has given beautiful children, when we are playing around, I noticed that when we're playing with some toys, that she enjoys the thicker toys that is available. And I feel that when I am having sexual intercourse, she's not feeling it as much as a toy that we play with. And that's why I think a lot of men, they just want to improve their girth, and Penuma delivers. Penuma, compared to other modalities such as fat injections or fillers, is a permanent implant. It is a solid silicone. It will not migrate. It will not travel. We have had a lot of problems with patients who come to us with fat injections where the fat doesn't want to stay. It causes a lot of irregularities and lumps and bumps. And also fillers can cause a lot of contraction and scar formation. There is no ideal solution for penis enlargement, but in my belief, Penuma, the new techniques, new procedure, are really able to deliver enough safety that we can recommend it to patients who are good candidates for this procedure.
Yeah, I think this procedure has come a long way. I think one of the problems with the fillers is that while the appearance of the penis may be fine, once you have intromission, once you put it in the vagina and it tightens up, you lose it because it's fluid. It is not solid. And so you lose that firmness or that thickness that you normally get with a silicone block that's in there. And the sensation is exactly the same for the male, but the woman really feels the thickness, which is really impressive.
Penuma surgery takes about 35 minutes to 45 minutes. It is done under twilight, which is, a local and some IV sedation. Patients are able to go to a hotel. For Washington, D.C. or New York, you need to stay in the area for about 4 to 5 days. It is required that you do not travel long distance to come back. You need to stay in the area because we have to leave a drain that will be removed 3 days later. You must be dedicated to avoid sexual activity, masturbation, or sex for 6 to 8 weeks to let everything settle. So this is an absolute commitment that you must make.
Yeah. Again, the commitment is an important word. This is not a commitment, just financial commitment. This is a commitment in your health and your evolution of your procedure to make sure you have the best possible outcome. And if you don't follow these things, especially if you're smoking, if you're driving, if you're doing too much activity, that can really set you back and not allow the implant to sit in there properly.
So why do you think everyone must be circumcised to have Penuma?
So it's very interesting. If you look at the anatomy of the penis, the foreskin moves up and down, right? Well, it moves up and down based on the girth of your penis, when it's erect or when it's flaccid. Now you've increased the girth by an extra inch and a half. Guess what? That foreskin is not accommodated to be able to have that movement up and down. And so what it is going to trap more fluid at the foreskin, and then the foreskin is going to get very tight, and it can rip because it has to accommodate this extra girth. You cannot do it with a person that's uncircumcised because that skin is not going to move. An alternative that we've been thinking about, and I'd like to get your thoughts on that, is doing a dorsal slit. That would widen it, but then the appearance would not be as clean. You know what I mean?
Yeah, a dorsal slit is, I usually do it for nursing home patients.
Yeah, right, exactly. But you'd be surprised because there's a lot of guys that are ordered circumcision, and just that. But in an adult male, you want this to be an aesthetic procedure. You want it to look nice. You want it to look smooth. And I think the circumcision is essential. And it should be done at least 3 months in advance.
Absolutely.
I don't know about you, but I don't allow any of my patients, I don't do any of my patients unless it's 3 months in advance.
Absolutely, because you have to let the skin heal itself. For those of you who want to learn more about Penuma Implant and the services performed by Dr. Valenzuela, his website is
ValenzuelaUrology.com.
Perfect. And he is in New York City. My website is betterbodymd.com. We are located in Washington, D.C. There are other centers, one in Beverly Hills with Dr. Ellis. Dr. Kansas is in Austin, Texas. Dr. Blick is in Scottsdale, Arizona. Dr. Karpman is in Los Gatos in California. Dr. Lawrence Levine in Chicago. We have Dr. Geiler located in Miami, Florida. And we also have
Dr. Henry.
Dr. Gerald Henry in Shreveport, Louisiana. Who else?
I think
so, the names that I just mentioned to you, these are legends of urology. These are the top-notch prosthetic urologists.
That's right.
Some of these names that I mentioned are authorities on Peyronie's disease, on penile prosthesis, on infertility. So we're very proud to have a great team of top-notch urologists, and obviously Dr. Ellis, he is the inventor and the legend that has gone through thousands of this procedure in the past decade. Thank you so much for listening. If you would like to comment, please feel free, or you can contact us at any time. We're happy to serve you and see if you're a good candidate for Penuma Implant. Thank you so much.
Thank you. It was a pleasure being here.